how much do we think that the government should be involved in providing health insurance coverage to citizens? How much do we want to kind of redistribute wealth in this country, and how much do we want to guarantee access to insurance coverage and to to actually accessing healthcare? There's a lot of uncertainty being fostered by politicians right now, and it's making it very difficult for insurers to kind of commit to continuing to exist and operate and sell policies.
Healthier individuals or citizens don't want to buy insurance. Older individuals who consume more healthcare want to buy insurance. And if that happens, then premiums escalate, and if premiums escalate, the healthier population drops out. So there are a variety of solutions. One is mandating insurance, which is what Obamacare or the Affordable Care Act did. The other is high-risk pools, so which is basically now going on the other side and saying, let's take the most expensive people out of the private insurance market and let's just provide them insurance separately. And the question is, how do you fund this high-risk pool? The third option is to subsidize healthier people, which was what was again happening under Obamacare.
The question is it fiscally sustainable? So, and in the case of high risk, for example, one option we've had in the past is to say, take these people, put them in a high-risk pool. It creates, the insurers no longer have an incentive to compete to avoid these people, and it's not very wasteful, and the market can function much better. When states have done that, though, the answer is that people in the high-risk pool, the insurance has gotten very expensive because the state hasn't been willing to throw in the money. The premiums get so high and the risk pool basically collapses.
This is a very small percentage of the people that are in the population who are spending a very high amount of the dollars. And insurers have worked very hard to essentially try to avoid having those people in their individual insurance products unless they're adequately compensated for having them. You kind of can't take on the risk of potentially covering all the people who have all the very high expenditures and only collecting a premium that's like the average premium in the market. The number of insurers participating in these exchanges has significantly fallen since 2016 and even since before.
There are some states that are already down to 1 or 2 insurers, and a lot of them are red states. And then there are other states where the marketplace is quite active and they're quite a functioning healthcare marketplace.
I think that there's a clear kind of issue or concern that we're very likely going to have areas that have no insurers who are willing to sell policies.
I don't think that the questions are really about, should we invest in education or make sure everyone has health insurance? It's maybe everyone should have health insurance, we should invest more in education, but we should think about how we're spending the healthcare dollars.